Second class requirement number 6, part C.
Demonstrate first aid for an object in the eye, the bite of a rabid animal, and for puncture wounds from a splinter, nail, or fish hook.
For serious second-degree partial thickness burns, heat exhaustion, and shock.
And for heat stroke, dehydration, hypothermia, and hyperventilation.
If your victim has an object in their eye, first have them blink their eyes several times to see if tears will flush the object out. Blink your eyes. If that doesn't work, you want to wash your hands with soap and water. And then try to flush it out with clean running water from a faucet or water poured from a bottle. Now, if the foreign object is embedded and won't wash out, you want to cover the eye with a dry, sterile gauze pad and then get medical attention immediately. When someone's bitten by a warm-blooded animal, like a cat, a dog, or a wild animal, you need to be concerned about having that animal tested for rabies. But never put yourself at risk trying to catch the animal. Call the police, the rangers, or the animal control department. If the animal is a pet, get the owner's name and address. Now, to treat the wound, scrub it first with soap and water to remove any animal saliva. Then, flush it with clean water for 5 full minutes. And finally, cover the wound with a sterile bandage and get the victim to a doctor. Now, a puncture wound from something like a nail or a fish hook makes a very small hole, but don't let that fool you. The danger is from the infection caused by the germs that get pushed inside that hole by the nail. Now, to treat this kind of wound, you want to flush out the dirt and particles with clean running water for 5 minutes. Use a pair of tweezers that have been sterilized with flame, alcohol, or boiling water to try to pull out splinters, glass, or any other objects. Control any bleeding with sterile gauze pad and apply a clean, sterile bandage. Then, get the victim to a doctor. Oh, if the puncture is from a fish hook, it requires special attention because of the barb at the end of the hook. First, if the hook is embedded in the face, eye, or ear, never try to remove it yourself. Get the victim to a doctor. Also, never try pulling the hook back out the same way it went in. The barb will cause even more damage. First, cut the line. If it's impossible to get the victim to a doctor and you have to remove the embedded hook yourself, push the hook further in until the barb comes out through the skin. Then, you can use clippers or wire cutters to snip the barb off. Then, pull the shank back through the entry hole. Treat the wound then as if it's a puncture wound. Ooh, that looks painful. This is a partial thickness or second-degree burn. Now, partial thickness means that it affects the epidermis, or outer layer of skin, and the layer just below that, called the dermis. These partial thickness burns are more serious than superficial burns that are first degree. For example, scalding by boiling water can cause the reddening and blisters that are typical of partial thickness burns. Now, to treat these wounds, you want to run the burned area under cold water until the pain is relieved. Let the burn dry, and then apply a loose-fitting, sterile bandage. Anytime a person is injured or under great stress, his circulatory system can have problems getting enough blood to all parts of the body. That's called shock, and without treatment, it can be deadly. When an injury or illness is serious, it's almost always accompanied by shock. Symptoms can include restlessness or irritability, feeling of weakness, confusion, fear, dizziness, moist, clammy, or pale skin, a quick, weak pulse, shallow, rapid, irregular breathing, nausea and vomiting, and extreme thirst. Even if no symptoms are evident, prompt treatment can prevent shock from setting in. Treatment includes removing the cause of the shock by treating wounds or bleeding, restoring breathing and circulation, and relieving pain. Summon emergency help as soon as possible, and keep the breathing airways open. Make sure the victim lies down. If there are no neck, back, or leg injuries, raise the feet to move blood to the vital organs. And then keep the victim warm with blankets, coats, or sleeping bags. Now, since fear and uncertainty can increase shock, use a calm voice to reassure him that help is on the way. Extremes in temperature, both heat and cold, can cause a need for first aid. For example, you can suffer from dehydration, in both hot and cold weather conditions. The human body is more than 70% water, and our body temperature and vital organs depend on maintaining that balance. Dehydration occurs when we lose more water than we take in. I don't feel so good. The symptoms for dehydration, mild dehydration, include thirst, dry lips, and dark yellow urine. Moderate to severe dehydration can mean severe thirst, dry mouth and skin, weakness and dizziness, confusion, nausea, fainting, muscle cramps, loss of appetite, decreased sweating, decreased urine production, and less frequent and dark brown urine. To treat mild dehydration, drink plenty of water or sports drinks and replace fluids and minerals. 1 to 2 quarts over 2 to 4 hours. Severe dehydration calls for emergency care with intravenous fluids and up to 36 hours to fully recover. Now, heat stroke is like heat exhaustion squared. There are 2 types. Exercise-related heat stroke with all the symptoms of heat exhaustion, plus red skin, disorientation, and a rapid pulse. And a type of heat stroke that usually happens to the elderly in hot, humid weather. Their symptoms involve hot, dry skin because there is no sweating. In the event of heat stroke, call for medical assistance immediately and work to lower the victim's body temperature with shade, air conditioning, wet towels, and ice packs. And if the victim is able to drink, allow the sipping of fluids. When your body's losing more heat than it can generate, that's hypothermia. And that can be deadly too. The temperature doesn't even need to be freezing. Hypothermia is a danger to the rain-soaked hiker or the capsized paddler. Now, you may feel numb or tired, shiver, even pass out. And if you wait too long, it's fatal. You treat hypothermia by warming the victim any way you can. Get them inside a sleeping bag or a blanket, give them something warm to drink. Or maybe apply a water bottle filled with warm liquid. Whatever it takes. And then get medical help immediately. Finally, it's time to catch our breaths. But that can be a problem if you have hyperventilation. It's when you get so anxious or scared that you start breathing too quickly and deeply. That forces carbon dioxide out of the bloodstream, and it makes you feel like you're suffocating. Hyperventilation can be caused by severe pain, infection, severe bleeding, heart attack, cold water immersion, diabetic coma, poisoning, or a condition like an anxiety attack. The victim might feel numb, dizzy, or faint. They may have tingling or cramping in the fingers and toes. Hyperventilation usually requires immediate medical attention. In the meantime, try to calm the victim and have them breathe slowly into a paper bag to get more carbon dioxide back into their system.
That's second class requirement 6C. A lot of important first aid treatments you need to know. So review them and then review them again in detail in your Scout handbook. And when you know you're ready, demonstrate them for your Scout leader.